You've beaten skin cancer, and that's a huge win. But now comes the next question, the next big question. What kind of scar will I be left with? So in this video, I want to give you a real answers, not just about the scar itself, but what you can do, what you can control, and what you can't, and how to feel confident about moving forward with your scar. We'll go through what makes skin cancer scars different, what shapes their look, and why some widen even when your surgeon has done everything correct. I will also walk you through a realistic healing timeline and, most importantly, things that you can do early on the way to get the best result. Why then are skin cancer scars different? Skin cancer scars aren't like a neat mole removal, cosmetic removal, or a straight surgical line. In Australia, most skin cancers show up in parts of the body that move a lot: the face, the chest, the scalp, and shoulders. These areas stretch, wrinkle, and are often sun damaged already. This kind of skin scars differently. It doesn't usually form keloids, but it does stretch more easily, stays pink longer, and responds differently to injury. So this isn't just about the cut. It's about where the cancer was, how it was removed, and who's healing. There are three big factors that shape how your scar will look: location, genetics, and surgical needs. Let's start with location. Scars over joints, the chest, the shoulders tend to widen over time, even with excellent stitching, simply because these areas move so much. Areas like the temples and cheeks heal well, but they aren't still either. A good surgeon will follow relaxed tension lines, the natural folds in your skin, to help the scar settle flatter and softer. Now for genetics. Your genetics. If you have fair skin that burns easily and freckles, what we call Fitzpatrick type 1 or 2, you are more likely to get scars that spread rather than rise. These scars usually stay pink for a few months and slowly fade into ivory or pale tan. People often call any raised scar a keloid, but the true keloids are rare in this group of people. Then there's surgical need. Sometimes what looks like a tiny spot on the surface is much bigger underneath. This is what I get commented on all the time. My spot is so small, but the scar is so big. Your surgeon may need to cut wider or even use a flap or skin graft to close things properly. Yes, the scar might look bigger, usually bigger than you expect, but it usually means that the cancer was removed completely and safely, and that's the priority. Let's be honest, the surgeon's technique makes a difference. It's not just about removing the cancer, it's also about how the cut is placed, how the wound is closed, and whether the surgeon respects the skin's natural lines and movement. A skilled skin cancer doctor will use deep layers stitches and plan to shape the wound carefully, do their best to hide or minimize tension. But not all doctors are trained the same way. Also treat skin cancer, and they focus on safety, which is essential, but they may not prioritize how the scar looks. That's why some scars run across wrinkle lines and end up in places that stretch more. Still, even the best surgeon, the best surgical technique needs good aftercare, and that's where you come in. It's a team effort. The cut, the closure, and the care. Before I go to mention what you can do to care for your wound, let's explain some things. Why scars widen? Scars widen most in areas that move a lot and carry tension, like the shoulder, chest, and joints. And it's not just motion, it's the years of sun exposure that has broken down your skin's collagen and elastin. That weakens the anchors in your skin, and even a well-closed wound can stretch out over time. It's not bad surgery, it's just biology. Now, what you can control. The first 6 weeks after surgery are gold, and there's a lot you can do to improve your scar during this time. First, support the scar. First, support the scar once your stitches have been removed. Use micropore tape or silicone gel or sheets every day. They help reduce tension and keep the scar flat and soft. If your wound is on your leg, elevate it a bit each day to keep swelling down. Once the wound has closed, start using SPF 50 plus sunscreen daily. This helps prevent uneven color or blotchiness in the scar. Second, hard to do. Limit movement and strain. For scars on your shoulders, chest, or back, avoid heavy lifting or fast arm swings for the first few weeks. After week 2, gentle movement and stretching are okay, but don't overdo it. Third, keep it cool and dry. Avoid overheating, sweaty workouts, or long periods of standing. Moist, inflamed skin makes scar more active and more likely to thicken. Calm, dry, supported skin heals better. So the simple steps are tape, silicone, sunscreen, gentle care. These are cheap, practical, and proven. Most people panic at week 2 or 3, right after the stitches come out. The scar looks red, lumpy, and uneven. That's normal. Here's what to expect, especially for fair skin. Weeks 0 to 2. A pink swollen line. Stitches come out around day 7 to day 14. Keep it clean and covered with ointment. Week 2 to 8. It may still look bright red, even itchy or firm. This is when silicone and tape help most. You can gently massage it after week 3 or even use it earlier. Now, 2 to 6 months. Yes, it takes months. The scar fades from red to tan to pale. Keep using sunscreen. Some people keep using silicone at night. 6 to 18 months. The scar is still active. It is still continuing to mature, to soften and to settle. If it's still thick or tight after this time, talk to your doctor. And by the way, week 5 often looks the worst, and that's normal. So don't panic. Common myths and many things you can do to help your scar after it's healed. You can put vitamin E. Does it help? No reliable evidence. You can use other things, bio oil, or simply just ointment. A neat outer stitch does not guarantee a neat scar in the end. It is the factors above that I mentioned, the movement, the stretching, the tension, that changes scar over months. And the term keloid, all thick scars are keloid? No, not true. Most are just stretched. Most are just thickened, hypertrophic. Keloids are rare, very rare in fair skin. However, it's a term that we use too loosely. Keloid isn't a catch-all term, and calling every scar a keloid adds to confusion. If the scar is itchy, usually around week 4, silicone and massage can help. About 1 in 3 people feel self-conscious about their scar for up to a year, and that's human. If your scar is over a joint and limits movement, talk to your doctor. There are ways to help. But honestly, not knowing what is normal is often scarier than the scar itself. So have a real plan. When scars don't behave, you can do things. When scars don't behave, despite your best effort, a scar that thickens or spreads. If that happens, your doctor might suggest other treatments like steroid injections, pressure garments, or laser therapy, maybe even revision surgery. You don't need a perfect scar, just one that's flat, soft, pale, and easy to forget. Half your result is genetics, something you can't change. The other half is what you can do in the first few months. Support it, protect it from the sun and tension. Understand the healing stages and don't panic too soon. Understand the healing stages so you know what to expect and what not to. If your scar fades into the background and you barely notice it after a while, you've done really well. That scar is your proof. It means you caught the cancer before it caught you. If this video helped you understand what's happening and what you actually can do, I'd love to hear from you. Drop a comment. I read everyone, and your question might help shape the next video. If you value true, honest, evidence-based health without hype, click like and subscribe, and share this with someone who might be going through skin cancer surgery. Thanks for watching. Take care of your scar and take care of yourself. Every scar tells a story.